Hi, I'm Dr. Matt Novarr at Columbia Pike Animal Hospital, and today we're going to talk about heartworm disease in dogs and cats. Heartworms are parasites that are spread by mosquitoes, meaning even indoor pets can get them. Basically, the mosquito bites the cat or the dog, injects them with the immature stage of the heartworm that then over time migrates to the heart where they reach sexual maturity and can reproduce. The scary thing is there might not be any signs for a long time. If a pet has a low parasite burden, meaning only a few worms in the heart, you might not see anything. But eventually over time, as the parasites reproduce, more and more of them can form the heart and the vessels around the heart. And that is what leads to the clinical signs. You can get heart enlargement, it can lead to heart failure, it can lead to pulmonary hypertension, although the only clinical sign you might see initially might be a little coughing. We diagnose heartworms with routine screenings. So every year we want to do heartworm tests. So it's just a small blood sample and we can detect the sexually mature stage of the heartworm. So you should always test your pet for heartworm if you've missed multiple doses of your heartworm prevention, or at 6 months when they're puppies, we start to do heartworm testing. Heartworms aren't transmissible directly from dog to dog, but the way it would spread is that a dog that has heartworm would get bit by a mosquito, and then that mosquito would have the immature stage of the heartworm and then bite another dog and spread it to that other dog. And so by all of our pets having heartworm prevention, it's preventing the spread as well as preventing your own dog from getting the parasite. So the heartworm prevention. For cats, generally we'll use either Revolution Plus or Preventable Plus. It's a topical that you put on either once a month or once every other month, depending on the product. For dogs, usually we're using heartworm pills. We also have the Pro Heart shot that you can pursue if your dog doesn't take pills well. Heartworm preventatives are very safe. Pretty much every dog is on them. They've been used for years. There's minimal side effects that we see. For the most part, dogs take them as treats and do very well on them. So if you don't treat heartworms, it varies in the animal. So for cats, cats aren't the definitive host for heartworm. And so they generally have a low parasite burden. It might resolve it on its own, or it might cause clinical signs. It's hard to predict. For dogs, since they are the definitive host of the parasite can reproduce and you can form lots of worms and they can grow to a foot in length in your heart and the surrounding vessels. And that's when you get heart enlargement, pulmonary hypertension, potential heart disease that you can't change if these chronic changes have already taken place. If you've missed 1 month, it should be fine, just start again. If you miss multiple months, ideally we do a heartworm test, make sure it's negative, and then you start back up on the medication. One of the other reasons why heartworm prevention is so important is because the treatment's very difficult. Basically, a year of treatment. And you can go on the American Heartworm Society website and you can see the whole protocol, but generally it involves these painful shots that we have to give to kill the adult heartworm. And when we give these shots, we have to monitor closely for any reactions as the worms die off. And so it involves us giving this painful shot and monitoring them here for a whole day. And we have to do that 3 times. And then we're doing various tests to make sure that there's no immature heartworms or mature heartworms left. And guess what? They're on their prevention this whole time anyway, so we might as well have prevented it. And not only is it painful when we give these injections to kill the adult worms, but it's expensive. And it is multiple times cheaper just to do the prevention and avoid us having to worry about doing this whole ordeal of treating adult heartworms. Thanks for watching this video. If you have any other questions about heartworm disease, don't hesitate to ask us.